The difference between mental disease, mental illness and emotional disorders in communities of color. By His Excellency Ambassador Dr. Andrew Ramjohn. Overall, it's important to recognize that mental health is complex and multifaceted. Individuals from communities of color may face unique challenges in accessing mental health services and receiving appropriate care. Mental health is a broad term that can encompass a range of conditions and experiences. It's important to understand the difference between mental health diseases, illnesses, and emotional disorders in communities of color, as they often face unique challenges in accessing and receiving appropriate care. Mental health diseases, such as schizophrenia, bipolar disorder, and major depression, are typically characterized by specific symptoms and diagnostic criteria. These conditions can affect anyone regardless of race or ethnicity, but research suggests that individuals from communities of color may be less likely to receive proper diagnosis and treatment. This can be due to a variety of reasons, including cultural stigma surrounding mental illness, lack of access to mental health services, and mistrust of healthcare providers. Mental illness, on the other hand, refers to a broader range of conditions that impact an individual's mental health and well-being. This can include a wide variety of conditions such as anxiety disorders, mood disorders, eating disorders, and personality disorders. Mental illnesses can also be diagnosed through medical evaluations and psychological testing. Emotional disorders, borderline personality disorder and attention deficit hyperactivity disorder, ADHD, are often characterized by emotional dysregulation and difficulty regulating behavior. Like mental health diseases, these conditions can affect anyone, but individuals from communities of color may face unique challenges in accessing care due to cultural stigma and lack of resources. When it comes to communities of color, there are often additional social and cultural factors that can complicate the diagnosis and treatment of mental health issues. For example, there may be stigma surrounding mental illness or a lack of access to culturally sensitive mental health care. It's important for mental health professionals to be aware of these issues and work to address them in order to provide effective care for individuals from diverse backgrounds. In summary, the pandemic, economic uncertainty, and social unrest in many parts of the world have all taken a toll on our mental health, and many people are struggling to cope. But I believe that with the right support, we can all learn to manage our mental health and build #resilience in the face of adversity. So as we get started, let's hear and see how we can work together to promote mental wellness and improve our quality of life. Thank you kindly for your attention.